Here's something that might surprise you. If you're over 60, there's a very good chance that at least one medical test you've been offered or scheduled for could actually create more problems than it solves. And in 15 years of practicing medicine, I've ordered thousands of tests. But I've also seen the other side, the unnecessary anxiety, the cascade of follow-up procedures, the complications from tests that were never truly needed in the first place. Today, I'm going to walk you through 5 medical tests that many healthy adults over 60 routinely receive and explain why I would personally think twice about each one. This isn't about avoiding healthcare. It's about understanding when a test truly benefits you and when it might not. Because after 60, the calculation changes. What helps at 45 doesn't always help at 75, and sometimes the smartest medical decision is knowing when to say no. Let me explain why screening tests become more complicated after 60. When you're younger, finding a problem early usually leads to a clear benefit. You have years, even decades, ahead of you where catching something early makes a real difference. But as we age, several things change simultaneously. First, many screening tests have higher false positive rates in older adults. That means the test suggests a problem when there really isn't one. Second, the risks of follow-up procedures, things like biopsies or surgeries, increase with age. Your body doesn't bounce back as quickly from complications. Third, and this is crucial, many conditions that tests might find grow so slowly that they would never have caused problems in your remaining lifetime. So when a doctor recommends a test, the most important questions become, what will we do differently based on the results? What are the risks of the test itself and any follow-up procedures? And honestly, does finding this problem change my quality of life or just create worry? These are the questions I ask myself, and they're the questions I want you to feel empowered to ask your doctor. The first test on my list might surprise you because it's heavily advertised as cutting-edge preventive care. Test number 1 that I would personally avoid is whole body scans marketed directly to consumers. You've probably seen these advertisements, executive health packages promising to find problems before symptoms appear. They sound appealing. Who wouldn't want a complete picture of their health? But here's what the medical evidence actually shows. Studies indicate that up to 40% of healthy adults who undergo whole-body MRI or CT scans will have some kind of finding that requires follow-up. The problem is that many of these findings are what we call incidentalomas, things discovered by accident that would never have caused any symptoms or problems. A small kidney cyst, a tiny lung nodule, a benign liver growth. These are extremely common as we age. They're like the gray hairs of our internal organs, completely normal parts of aging. But once we find them, we can't unfind them. Suddenly you're labeled as having an abnormality. Your doctor feels obligated to follow up. That might mean more scans in 3 months. It might mean a biopsy, which carries real risks like bleeding or infection. In some cases, it leads to surgery for conditions that literally would never have bothered you. Let me tell you about Helen, a 67-year-old patient of a colleague. Helen was healthy, active, no symptoms whatsoever. She paid $4,000 for an executive health scan. The scan found a small spot on her lung, just 5 millimeters. Statistically, spots this size in non-smokers are benign 98% of the time. But once it's found, it has to be followed. Helen had 3 more CT scans over 18 months, each one exposing her to radiation. The spot didn't change, which is good. But Helen spent those 18 months terrified she had cancer. She couldn't enjoy her retirement. She withdrew from activities. The scan that was supposed to give her peace of mind stole it instead. What I recommend instead is a comprehensive geriatric assessment. This is a thorough evaluation by your doctor, focused on what actually predicts health at your age. It includes checking your functional status, how's your balance, your walking speed, your grip strength. These simple measurements predict your health and longevity better than any scan. It reviews all your medications for potential problems. It assesses diet, exercise, sleep, social connections. This gives you actionable information about what you can do to stay healthy. A whole body scan just generates anxiety and triggers more testing. The second test is one that many people request themselves when they notice minor memory changes, but the results often cause more harm than reassurance. Test number 2 I would personally reconsider is a brain MRI for mild memory lapses in otherwise healthy adults. This happens all the time. Someone over 60 forgets where they put their keys or can't recall an actor's name. They or their family get worried and request a brain scan to rule out Alzheimer's disease. The problem is that research shows 94% of people over 75 who get a brain MRI will have findings that are labeled abnormal. Think about that. 94%. These findings might include mild brain atrophy, which simply means your brain has gotten slightly smaller with age. That's completely normal. Or white matter lesions, tiny spots that look concerning on the scan but are found in over half of elderly individuals and usually represent nothing more than years of blood pressure that wasn't perfectly controlled. To a knowledgeable physician, a scan report showing mild atrophy and white matter changes in a 78-year-old basically says, "This brain belongs to a 78-year-old person." But to you and your family, those medical terms sound terrifying. They sound like a diagnosis of dementia. And here's what happens next. People start doubting themselves. They withdraw from activities. They lose confidence in their own minds. All because of findings on a scan that have nothing to do with their actual cognitive function. I saw this with Robert, a 72-year-old retired accountant. He occasionally misplaced his glasses, normal for anyone. His daughter insisted on a brain MRI. The report mentioned moderate cerebral atrophy and scattered white matter lesions. Robert was convinced he had Alzheimer's. He stopped doing his beloved crossword puzzles because he thought, "What's the point?" He declined an invitation to teach a class at the senior center. His mood plummeted. But when we did actual cognitive testing, his scores were completely normal. The scan findings were age-appropriate changes, not disease. It took months to undo the psychological damage that scan report caused. The better approach is simple cognitive testing right in the doctor's office. Tests like the Montreal Cognitive Assessment take about 10 minutes. They actually measure how your brain is functioning, not just what it looks like. If the test is normal, you can be reassured. If it shows problems, then we look for reversible causes, and there are many. Vitamin B12 deficiency, thyroid problems, depression, sleep apnea, medication side effects. We should check all of these before ever ordering a brain scan. If cognitive testing shows progressive decline and we've ruled out reversible causes, then imaging might make sense. But for simple forgetfulness, a brain scan usually creates more problems than it solves. Test number 3 involves your heart. And it's one that surprises people because it seems so sensible on the surface. Test number 3 I would personally avoid is routine cardiac stress tests in healthy adults with no symptoms. Now, if you have chest pain, shortness of breath, or other cardiac symptoms, a stress test absolutely makes sense. But for someone with no symptoms, who can climb stairs and walk briskly without problems, routine stress testing often creates more trouble than benefit. Here's why. Stress tests in asymptomatic older adults have a surprisingly high false positive rate. That means the test suggests a problem when there really isn't one. Why does this happen? As we age, changes occur in the heart and blood vessels that can affect test results without meaning there's a dangerous blockage. Thickening of the heart muscle, electrical changes in the heart, effects of long-term blood pressure, all of these can cause abnormal stress test results, even when the coronary arteries are perfectly fine. So what happens when you have a false positive stress test? You're sent for more testing, often a cardiac catheterization, where a tube is threaded through your arteries to your heart. This is an invasive procedure with real risks: bleeding, infection, damage to arteries, kidney problems from the contrast dye used. I remember Linda, a 69-year-old who had no cardiac symptoms whatsoever. She walked 3 miles daily without any problems. Her doctor ordered a routine stress test as part of her annual physical. The test came back abnormal. Linda was terrified. She underwent cardiac catheterization, which showed completely normal arteries. The stress test was wrong. But during the catheterization, she developed a complication at the puncture site in her groin that required surgery to repair. She spent 3 days in the hospital and 6 weeks recovering, all because of a test she never needed in the first place. If you want to assess your cardiac risk without these problems, there's a better option called coronary artery calcium scoring. This is a quick, low-radiation CT scan that measures calcium in your arteries. A score of 0 means very low risk. A high score tells you that you need aggressive prevention with medication and lifestyle changes. It's informative without triggering the cascade of interventions that can follow a false positive stress test. And honestly, if you can climb 2 flights of stairs without stopping, or walk briskly without chest discomfort, you're already passing a stress test every day. Your daily activities are telling us your heart is working fine. Test number 4 has excellent benefits at younger ages, but those benefits shift significantly after 75. Test number 4 that requires careful consideration is routine colonoscopy after age 75, especially if your previous screenings have been completely normal. Now, let me be very clear. Colonoscopy is an excellent screening tool. I strongly recommend it starting around age 45. It saves lives by finding and removing precancerous polyps. My concern is continuing routine colonoscopy into advanced age when you've had normal screenings and have no symptoms. Here's the issue. The benefit of colonoscopy is preventing colon cancer that would develop 5 to 10 years down the road. But if your life expectancy is less than 10 years, either due to age or other health conditions, you're less likely to benefit from screening. Meanwhile, the risks increase with age. The bowel preparation alone can be dangerous for older adults. Drinking large amounts of laxative can cause severe dehydration and electrolyte imbalances, which can trigger serious problems if you have kidney disease or heart failure. The sedation carries higher risks in older adults, including confusion, breathing problems, and dangerous drops in blood pressure. And there's the risk of perforation, a tear in the colon wall. While rare overall, occurring in about 4 per 10,000 procedures, the risk is higher in people over 75. The colon wall gets thinner with age. A perforation often requires emergency surgery, and for an 80-year-old, this can mean the end of independent living. The U.S. Preventive Services Task Force, which reviews all the evidence, recommends that screening decisions between ages 76 and 85 be made individually, considering overall health and prior screening history. They recommend against routine screening after age 85. This doesn't mean we ignore colon health after 75. It means we shift from screening to surveillance. You need to know the warning signs: persistent change in bowel habits, blood and stool, unexplained weight loss, new anemia, persistent abdominal pain. If any of these occur, investigation is absolutely warranted, regardless of age. And prevention continues to matter. A high-fiber diet with fruits, vegetables, whole grains, beans, and lentils is your best protection for colon health. This dietary approach is much safer than repeated colonoscopies and benefits your entire body. The 5th and final test has been controversial for years, and the evidence against routine screening in older men keeps getting stronger. Test number 5 I would personally reconsider is PSA screening for prostate cancer in men over 70. The prostate-specific antigen test has created what many physicians call an epidemic of overdiagnosis and overtreatment. Here's what makes prostate cancer different. It grows very slowly in most men, especially older men. Autopsy studies show that up to 80% of men in their 80s have prostate cancer at autopsy, but most died with it, not from it. It was just sitting there, never causing any problems. The problem is that the PSA test can't distinguish between aggressive cancers that need treatment and slow-growing cancers that will never cause harm. So we find all these cancers, and once you tell someone they have cancer, they want it treated. But treatment for prostate cancer is no small matter. Surgery can cause permanent incontinence and erectile dysfunction. Radiation causes similar problems in many men. These side effects dramatically impact quality of life. The U.S. Preventive Services Task Force reviewed all the evidence, and concluded that for men 70 and older, the potential harms of PSA screening outweigh the benefits. The chance of finding a cancer that would actually threaten your life is very small. The chance of overdiagnosis and harmful treatment is substantial. They estimate that overdiagnosis rates are more than 15 times higher in men over 85 compared to men in their 50s. Now, family history and other risk factors absolutely matter. African American men and men with a strong family history of aggressive prostate cancer may benefit from screening even after 70. But it should be a conversation, not an automatic test. An informed discussion about the real numbers, the real risks, and what matters most to you. For men who are diagnosed with very low-grade prostate cancer, active surveillance, monitoring without treatment, is often the best choice. Regular PSA tests and periodic exams keep an eye on things, but you avoid the life-altering side effects of treating a cancer that's very unlikely to harm you. So there you have them, 5 medical tests that after age 60 often create more problems than they solve. Whole body scans that find harmless incidentalomas and launch cascades of unnecessary testing. Brain MRIs for mild forgetfulness that generate anxiety without useful information. Routine cardiac stress tests with high false positive rates in healthy older adults. Colonoscopies after 75 when prior screenings were normal. And PSA testing in men over 70 that leads to overdiagnosis of slow-growing cancers. What connects all of these? They're examples of looking for problems in people who don't have symptoms. And as we get older, that kind of searching becomes less likely to help us and more likely to harm us. I want to emphasize this isn't about avoiding medical care. It's about smart medical care focused on what actually improves health and quality of life. Sometimes the most powerful thing a doctor can do is not order a test, but instead sit with a patient, really listen, and focus on what matters most to that individual. The goal of healthcare after 60 shouldn't just be finding every possible problem. It should be maintaining function, independence, and quality of life. If there's one thing I want you to take away, it's this. You have the right to ask questions. When a doctor recommends a test, you can ask why. What will we do differently based on the results? What are the risks? What happens if I don't do this test? These aren't confrontational questions. They're the questions of an informed patient taking charge of their health. Medical care should be a partnership. You know your body, your values, what matters most to you. Your doctor knows medicine. Together, you make decisions that make sense for you as an individual. So the next time someone suggests one of these tests, pause, ask questions, make an informed decision. Because the goal isn't just to live longer, it's to live well, with dignity, independence, and peace of mind. Thank you for watching. If you found this information valuable, please share it with others who might benefit, and subscribe for more evidence-based advice on staying healthy as we age. Leave a comment below. Have you ever felt pressured into a medical test you weren't sure about? How did you handle it? I'd love to hear your experiences. Until next time, remember that smart healthcare means knowing when to say yes and when to say no.